Hi everyone, and welcome to Atp Live Monday. I hope you've had a good day so far. I am Gbemisola Boyede, and I'm going to be your anchor for today. So, welcome everyone joining us on Facebook, on Instagram, on YouTube, whichever platform you're joining us from. You're welcome to ATP Live Monday. Major Evans, good evening. Thank you for your consistency. All right, you're here early today. I hope you've had a lovely day. Welcome, everyone, and welcome. I'm going live from my personal page today because Facebook has just been giving us some headache on our page. Because our page is a medical page, sometimes some of our contents kind of get flagged by Facebook unnecessarily anyway. But we're trying to resolve that. So just want to welcome everyone. And I'm going to just share the video to all the links. And please help me to share as well. To your friends and family so that all of us can everybody can join us. So ATP Live Monday is a program brought to you by Ask the Paediatrician Foundation, and it's a program where you get to ask any questions that you may have about the health of your children, and then I'll try and answer them in the 1 hour that I have. But just to let you know that even if you have questions afterwards, you can always post your questions to our Facebook group, Ask ATP. We have about 4 Facebook groups, to be fair. We have our Ask the Pediatricians, which is a main group where you can ask any questions that has to do with the health of children. We also have ATP Family, where you can ask questions that have to do with the adult health issues. We have ATP Still a Mom, and then we also have um, First Time Mom Facebook group. Those are other groups you can. Okay, you can ask your questions. Let me leave that. That's our Facebook page because it's echoing me. All right, so I think I've shared the video, but I'm just going to make sure I pin them. So feel free to start asking your question. Please, when you start asking question, remember to start with the age of the child. It amazes me how many times people ask questions and they always forget to put the age of the child. And without the age of the child, we cannot really answer your question because there are some things we need to. The way we answer question depends on the age of the child. Let me just leave it at that. So please start with the age. Is the most important information we need in your questions, and then try and keep it short and brief, and try and also go ask questions. It's amazing how many people also ask um, how many people will put a lot of information and then they don't even ask any question. I'm like, what do you want me to do with that information? I have no clue. And as much as possible, I try not to guess because sometimes you guess and you're way off, and then the person comes back to you just a wasted effort because that's actually not the question. So I always prefer people telling me what you want me to do with the information you've given me, so I will focus on that. So try and ask very specific questions, and then try and go straight to the point. I think those are the two most important information, and once you do that, we'll be fine. There are some questions we cannot answer because you have to post a picture or something, so that may be more challenging for us. So for those, I recommend that you our um go to our Facebook group itself. You can put a picture there. Please try not to put pictures of nudity. Or I know lots most mothers don't think about it because you are just asking medical question, but Facebook always flag it, and that is what is giving us a lot of headaches now. So please try and um, use pictures that don't show any private parts of the child. I think that's the most important information that I would like to share as far as that is concerned. Okay, so I think we are good to go. I'm just checking that all the things that we've shared are pinned and people can say. That's all I'm doing. Just making sure everything is is where they should be. So just give me one more minute to make sure all of them are pinned. I can see your questions already. Uh, just pinning and posting so that people will not say, "Oh, I didn't know." So let's just quickly do that, and then we can start. Okay, so welcome everyone. Let me now welcome you all generously again. Welcome. Good evening. Good afternoon, good day, whichever time of the week you're watching on. Welcome to ATP Monday. I'm Gbemisola Boyede. I'm a pediatrician, and I'm going to be here to answer any question that you may have about the health of your children in the next I guess I have only 53 minutes left. So if you have any questions, feel free to post, but you can also always post your questions if you are asking questions beyond the live session to our Facebook group. We're there Mondays to Saturdays, and we always try to answer your questions. So thank you so much for joining us. And beyond what we do online, we also do community outreaches and all that. So if you want to learn more about us, visit our website www.axipediatricians.com. All right, so let me go. I have a question on Facebook by name Precious. I'll go with Precious. Said my baby is 3 years plus, weight is 14.6. It's okay. She's a picky eater, but now it's worse. Okay, she eats little food and more of junk and sweet food. Please, what can I do? She's lean. Her limbs are visible. Is this a cause for concerns? Okay, so number one, the weight of your baby is actually more than okay for a 3 year old. An average 3 year old weighs 14 kilos. So 14 kg is perfectly okay for a 3 year old. So I'm not worried about the weight. So I'm not really sure the child is lean in the way you're looking at it, unless the measurement is inaccurate, which I can recommend that you have it checked again. So that's number one. So we are not too particularly worried about the weight. The weight is okay, but definitely we don't want your child eating junk and sweet food. And usually when parents say maybe eat junk food, and I'm like, the child does not go to the market to buy junk food. Okay, so it's an indirect indictment on the parents themselves. So because we are the one giving the children the junk food. If you've never given a child biscuits or any of those junk food, they will never know they existed. Trust me, they will never know. So most of the time, we are the one that started it by introducing the children to it, and of course the children will like it because they are full of sweet, sugar and salt. And so then when we now want to stop, it's a battle. So you are the one that has to also get rid of the junk food. The same way you introduce it, you get rid. Don't buy it. That's all. And then you give the child more of healthy options. So I've done a webinar this year because this is one of the most frequently asked questions again. So I've just done a webinar. Because on Thursdays we do teachings, and one of the teachings I've done, I think maybe the first or the second teaching I've done this year, is actually about fussy eaters. So I would recommend that you go watch that, because I went into details. Let me see if I can find the link and share it with you so that you can go and watch that video on fussy eaters. It's available on our YouTube channel. It's available on all our platforms. So on podcast, on every of our platforms, you can just search. Even on the same one you're watching on okay, you're watching on my own page now, but if you go to Atp Pediatrician Foundation Facebook page, then you can actually watch that particular. Okay, so I found the link. Let me copy the link. Okay, it's difficult to copy on Facebook on laptop, but I'll try. But if you go click on that, watch it, and then you can pick maybe one or two um tips. I think I gave almost like about 10 strategies for fussy eaters in that webinar. So, Precious, I would recommend that you go watch that first and utilize them. So, but bottom line is just keep offering the food, give choices, give healthy options, don't force feed, just as some of the highlights. And the child's weight is okay, so the child will be fine. So, I think I will just stop at that point. I don't have any question on Instagram. Instagram people ask your questions. So let me go on to the next question on Facebook. So Chide Bere say, good evening, Doc. My son will be 3 years by March 30th, but has not started talking clearly. So what do you mean by has not started talking clearly? Can you just be more specific? So what words does your child say at all? Can your child what are the words that your child can say? So can you tell us those ones first? Because that will be more relevant. And if the child speaking sentences, is that the child is talking, but the words are not clear, or the child is not able to put words together, because usually for a 1 year old, we expect them to do single words, maybe 1 to 3 single words. By the time they're about 2 years old, we expect them to be doing two words, phrases, and by the time they're about 3, we expect them to be speaking simple 3 to 4 word sentences. So I really want you to tell us which one is your child. And usually a 3-year-old should be speaking sentences, but sometimes the clarity may not necessarily be 100%. At least we expect the clarity to be about 75% to a stranger. So in that case, that is still okay for a 3-year-old. But if your child is not yet speaking sentences and all that, then you need to really see a you may want to see a speech therapist, and you'll be able to guide you. Usually we have on our group, we have a guide session on guide 9. It talks about what are the normal speech milestones. So you may want to for check that as well, so that uh, you can um you can check for yourself whether your child's speech milestones are okay. And then secondly, you want to know, is this child um, having other issues with other area of development apart from the speech? Are there behavior issues? So you want to look at all those options, and from there you can now, if there are more issues than just the speech, then you need to see a developmental pediatrician. But if there are issues um, uh, that is just only speech only, then the speech therapist alone will do. I hope that's not confusing. So, but if you have any more questions, feel free to ask. All right. I can't seem to find my. Anyway, let's just leave that one. All right, Instagram people, if you have question, hacks, I can't seem to see question on Instagram. I hope nobody has asked question and I missed them, but feel free to ask your questions and I will answer them. I was just trying to look for the link for the fussy eaters to share. Okay, so okay, I think I can get the podcast one. Okay, let's continue. Um, So we're still here. If you have any question, feel free to ask your questions. I'm just trying to send a link because I don't know why it's not showing on the on the StreamYard. Everything is just so. But I've just sent you the link to the one on the podcast, so you'll be able to see that as well. So I hope that's helpful. All right. So if you have your question, feel free to ask your questions now, and then we'll continue. Let me just make sure. All right. I'm not used to. Okay, so there's a question on Instagrams. Uh, RT signature food. Yeah, your name is plenty. You're asking, good evening, Mama. I just treated malaria and sepsis, bronchitis, pneumonia. Wow, in one child, in one single child. No, I don't think so. Anyway, let's just see your question. But the child is still running body temperature after being discharged a week ago. So the question I want to ask is: was the child fever off while you were in the hospital? Like, was the child completely fever free, and then you went home, and the fever now started again, or was the child never fully well before you went home? If you can clarify, because it's important for us to know whether this is a new illness or is still a continuation of the old one. So I really want that clarity. RT signature food, if you are still listening. So number one, I worry about your diagnosis. The fact your child was treated for malaria, sepsis, bronchitis, pneumonia, four things. I hope, I have a feeling that the bronchitis and pneumonia, maybe they go together. Maybe it's bronchopneumonia, in which case, maybe it's also part of, because usually when we use the word sepsis, we don't tend to now say pneumonia and this, because sepsis means it's an infection that is all over the place. But if it's just only in the chest, then we still say, okay, it's a pneumonia or it's a meningitis, that kind of a thing. So I just want to clarify that first. So uh, if your child was sick and was in the hospital and has been treated, okay, so your child was fully well. Okay, so if the child was fully well and now the child is sick again, so this is a new illness. So you need to go back to the hospital. I know it's very frustrating for you that your 7-month-old was sick and he was treated, and now the child is sick again after 1 week. But it is what it is. So you have to go back, and then you will now they will reevaluate the child again, and then they will then the question I want you to ask your doctor is like, why is the child sick again? So because this time around, the reason why it's important, because I cannot comment now is because I don't know what is wrong this time around. It may not be malaria again, it may not be pneumonia again, it may be completely something new, in which case it's just a new thing and it's a coincidence. But if it is still either malaria or pneumonia that was treated before, then the question is, why is it happening again? And then the question is, why is the child getting sick again and again? And then we want to know what is it that we can do to prevent the child being ill. So number one, this your baby is 7 months old. So I'm assuming you're just starting complementary feeding about a month ago. I hope you are still breastfeeding your baby, because a lot of mothers think when the exclusive breastfeeding period is over, it is time to go and rest and not to breastfeed. Please, you still need to breastfeed your baby, because breast milk is protecting your baby against infections. And this period is the period where the baby's own antibodies are running out. And so they need a lot from you. And that's why you should still keep breastfeeding your baby. And while you are giving complementary feeds, also make sure you are not um, exposing the child unnecessarily. So if your child is going to daycare or crèche, you also have to pay attention to that, because that's where most time they pick up all these germs and stuff. Sometimes you may want to keep your baby at home rather than take to crèche. So we have to basically, you have to think, why is this child being ill? What is happening? What are we doing that we can do better? What are we not doing that we should be doing? Because it's very, very unusual for a child to be getting sick back to back. Okay. And number two, I also don't believe that diagnosis that you said. I know your doctor must have told you that, but it's very unlikely for a child to have malaria and have pneumonia and have sepsis. I mean, normal. It's not really that it's not really that common for that to happen. But most time, because sometimes doctors were not yet sure, so we start thinking, okay, could it be malaria or pneumonia? But at the end of the day, we should have been able to confirm which of them we're dealing with. And I hope when you left the hospital, your doctor must have given you some medication to say, complete this treatment with this. I hope you completed them, because that's some of us, when we go home, all the fever and stuff, the child is well, we begin to forget all the other medications that we're supposed to give the child. And if you listen to one of the webinar I did also about, I think last week or 2 weeks ago, um we need to make sure we always finish our medications, especially antibiotics. Even if the child is well, if they say give it for 5 days, you must give it for 5 days. If they say give it for 7 days, even though the child has been well from day one, you must still give it for 7 days. There's a reason why we need to do that. Sometimes some of us don't do that. We don't complete the treatment, and so the thing can always happen again. So there are many reasons for what is happening again with the child, but I really just need you to go back to the same doctors who treated your child before, because they already know your child, so they can figure it out, which one it is out of all these possible. Is it a new infection? Is it a recurrence of the old infection? Is there something else going on? Because sometimes some children have some underlying illnesses, and sometimes it is because they are getting sick over and over again that will pick it up. I'm not saying that's what's happening to your child, and apologies for this example, but don't freak out because of that. But for example, if a child has like leukemia or is going to have any of those cancers, the first thing they do is that we just know that they get sick over and over again. And it is in that process that we begin to think why. Then we begin to investigate, that we'll now find out. So I'm not saying that's what's happening, but I'm just giving you all the possible scenarios where we need to look deeper to know why a child is becoming frequently ill. But the best thing is to go back to your doctor. How to signature. Thank you. Just let us know how it goes when you've gone by. You can post on our Facebook group and we can pick it up. Okay, Phenomena, we're ready to say good evening, Doc. My son will be 10 months this Thursday and not pulling himself up to stand, nor crawling. When I put a toy in front of him, he takes it, but when I push it away, he will start crying. Yeah. I don't punish the baby now. Okay, so thank you for your question, Philomena. It is not unusual for some babies not to crawl. Some babies would never crawl. So we don't use crawling per se as our own way of judging a child's development, because we know some babies don't crawl. So when they are ready, they either bottom shuffle, they move with their bum, not with they don't crawl on their hands and legs. So there are some babies like that. And some will just stand up and walk when they are ready. So the walking for most children is around like 12 months. Even the standing walking is between 11 to 12 months. So your baby is just 10 months old. Your baby is not even 10 months. Your baby will going to be 10 months on Thursday. So we're not particularly worried about your baby at this point. Okay, is your child able to sit on their own without any support? If the baby is able to do that, then that is actually what is expected. If your baby is one of those babies that is not going to crawl, there's nothing we can do about it. But if your child is not walking by 18 months, so you still have about 6-8 months in front of you, if the child is not walking by 18 months, then that's when we as pediatricians will begin to worry. I understand that it can be very frustrating for mothers, because obviously you've seen some other babies who are crawling and standing. Every child is different, and every child's developmental profile, the way they do their things will be different. As long as your child is not way off what is expected, we don't worry so much about it. So just don't worry about it. Just leave the baby for now. Don't try to force them, because development is a brain thing. It's not you forcing them or trying to encourage. It's okay to encourage, but you can't make the child do it. They have to do it when their brain is ready to do it. I don't know whether that makes sense. Well, it's the brain that will determine when a child does something. It is not what we try to make the child do. So don't worry for now. We'll keep an eye on the baby. All right, Oni Udoji, it's a good evening. My 20-month-old has bow leg, okay, which since he started walking, okay. I was advised to give calcium and coliverol by who? Okay, so don't just take advice from anyone. When it comes to health issues, I don't like you taking advice from just anybody, because everything is when it comes to medical issues, there's no one size fits all. So your child may have bow leg because in your family or in the dad's family, people tend to have bow legs, and it is just natural. It's normal for them. It's nothing wrong with the legs. It does not mean the child has low calcium or anything. So some people just have it naturally, and even some children, like I said, when they start walking, maybe a little bit bold, and as they get older and it's kind of straighten out on its own. It's just a normal thing for them. And usually it's not usually very obvious, just usually mild. Whereas some children may have medical reasons for their bow legs. So usually those ones are actually more severe. So we have rickets. So children who have vitamin D deficiency, calcium deficiency, they can have rickets. We also have some medical condition, we call it Blount disease, things that can make the legs to be shaped in an abnormal way. So there are other reasons. So it is not one size fits all. So if your child does not have calcium deficiency, so just going to give cod liver oil, it's just a waste. And you can actually give the child too much of vitamin, because vitamin D and all the fat soluble vitamins, they can get stored in the body. So you can have too much of them, because it's not like vitamin B and vitamin C. The reason why many of you get away with your vitamin C that you just give your children unnecessarily all the time is because it's water soluble, so the body just remove the excess in the urine. But vitamin A, vitamin D, vitamin E, and vitamin K, they don't get removed in the body, they stay in the body. And if they are too much, they can cause problem. That is why when we give children vitamin A, we give it every 6 months. Because when we give them one shot of vitamin A, one, sorry, not shots, oral vitamin A, we know that it's going to stay in their body for 6 months. So that's why we give vitamin A every 6 months. But no mothers, you give them every day, and then there will be a problem with that. So don't just start giving your child unnecessary medication. If you're worried about the bowing of the leg, you go to see a doctor. There are ways we can ask you questions. There are blood tests we can do to know whether this is just what we call familiar bow leg, or whether this is rickets, or whether this is Blount disease, or whether there is something, so we need to know which one. For example, rickets is the one that we'll treat with vitamin D, and will give calcium. But if your child has Blount disease, for example, you say surgery we're going to do. So different things require different treatments. So we don't just do things. Unfortunately, people just say, oh, like, because they give my baby vitamin D or calcium, me to, oh yeah, you to go and give. No, don't just take advice from people, because they can give it the wrong one. All right. So you said when the child wakes up each day, the legs look better and all that. Then when he plays that, the legs looks very bow again. That is really, how old is this child? 20 months old. That is really unusual. So your leg does not become soft and bow one day, and then the following day it becomes straight. It doesn't happen that way. The leg is not like it's not soft like that. This is bone we are talking about. So I think you are the one that is just naturally, as a concerned parent, I understand your perception. So sometimes it looks like, oh, it looks okay today, tomorrow is not looking okay again. I think that is all in your eyes. There's no way the child's leg will be changing from day to day. That will not happen. It's either it's getting more cuffed or it's just the same, but it's not going to be better one day and get scuffed the following day and get back. It doesn't happen that way. So I would recommend that you just see a pediatrician and let them have a quick look at the child. There are other signs we will see. For example, if the child has rickets, there are other signs we will see. Just doing an x-ray, there are signs that we'll see on x-ray, we will know that this is rickets straight away. So, and even on examination, so there are things we will see. So that's why when you see a pediatrician, we can take it up from there. So just see one first. Obviously, you are worried about it. See one, and then we will take it up from there. I hope that's up for. Let me just close that. Let me take the question that came up on Instagram, and I'll come back to Facebook, because Instagram question tends to disappear. Facebook is always there. Miss Fumi, good evening, doc. My baby will be 7 months on the 27th. Okay. Last week, some rashes, red patches broke out on his face. and it itches him too. I don't know what to do. It's difficult to answer question on rashes on this platform because I need to see the rashes. We don't see rashes, we can't talk about it. But the way you describe it, it sounds like what we call an allergic kind of rash. If something comes up suddenly on the face and it's itchy, most likely it may be something allergy related. So was this child exposed to something new? So think back, did you apply something new that you've not applied before, or you give a particular drug, or new food, whatever it is? You may have to think about it. Okay, you say you thought it was reacting to the follow-on milk, so I had to stop it and all that. Yeah, if the milk is new, another one, you give the milk the following day or the same day the child comes up with rashes. It could be, yes, it's possible. So there are many things a child can react to, but the way you describe it is actually sounded very much like an allergy kind of reaction. So I think you've done the right thing, which is if you think a child is reacting to something, just stop it. I mean, it's as simple as that. Stop it first. And usually, if this is a rash, is due to the allergy, it will just clear away straight away as well. So, but if it is not due to the product you are suspecting, it's not going to clear. It's going to actually um, be there or get even worse. So you know that it's not an allergy. But if you are suspected that because you just introduced a new milk and that is what is causing the reaction, then the good thing is to stop it. While we're on that, let me just quickly add that it is not compulsory to buy formula for a child with on complementary feeds. It's not compulsory. I don't know why we always rush to do that. I guess mothers just want to get their breast back, so they just want something to relieve that breastfeeding. But the truth of the matter is that your breast milk is still enough for your baby all the time baby is starting complementary feeds. So you can keep breastfeeding and be giving solid food, and you don't need to buy formula at all. You don't need to. So it's not compulsory, because I worry about it because a lot of mothers always think when your baby is 6 months, the first thing they need to do as part of going off the exclusive breastfeeding is to go and buy formula. And actually, that's the last thing you need to do. You don't actually need to buy formula at all, because your breast milk is still the milk that your baby needs. So you can give your other food, you can give your potato, you give your pap, whatever solids you want to give to the baby, but you don't need to buy formula. You can actually express your breast milk and add it to your pap if you want to give it that way. It's not compulsory to buy formula. I'm not saying it is also wrong if you want to buy it, but it is not necessary. It's really because some babies actually are allergic to the cow milk, and then some of them start having rashes. So for such babies, just put them back on their breast milk and stop the cow milk you introduce, but you can now give them other solid, the same kind of food that you have in your kitchen that you will eat. That will be all the baby needs. So, but if the rashes do not go away with you stopping the formula, you can always see a doctor. They will have a look at the rashes, and then they'll be able to advise you further. All right. Juliet Ishama said, my 1 year, 1 month old is looking small. What is the weight? 6 kilos. Wow. Wow, that is really, really small. I agree. That baby is malnourished. That is what we call marasmus. A 1 year old child should be weighing 10 kilos. So if that baby is weighing 6 kilos, that is 60% of the weight. That is severe. It's not even just that child is malnourished. That is severe malnutrition. That child needs to go to the hospital now. And I'm not saying go tomorrow. You have to go now, because that child needs to be rehabilitated. Because for children, we worry about their weight. Once their weight is so low, it's a battle for us, because any little infection, even ordinary malaria, can just or ordinary chest infection. When children have good weight, when they are sick, they are able to fight back those infections on their own with our little support here and there. But if a child is already so low on weight and they're so severely malnourished and all that, then it takes just very something so minute like diarrhea or malaria, or something that is so not a big deal, but it can knock them off easily because um they are already their reserve to fight anything is already so low. They don't even have any immunity. That is what happens when a child weight is so low. That's why we worry so much. Pediatrician will talk weight all the time, because 50% of all these issues that we have in children is the weight. Once the weight is gone, we are going to do it. Everything else will just start coming in. Everything else will start coming in. So Juliet, you need to take your child to the hospital now. And I mean that with all sense of responsibility. That child needs to be seen by a pediatrician. We need to know why your baby's weight is so low. Though your baby's was maybe a preterm baby, because your baby's weight at birth was 2 kilos. So that baby has always been small anyway. But then why was the baby 2 kilos at birth? But even if the baby was preterm and 2 kg at birth, 6 kg is still so. That means that your baby has only gained 3 kilos in 1 year. I mean, not even 1 year, in 13 months, that baby has only added 4 kilos. Sorry. And that is, baby should be adding at least 1 kilo almost every month, 900 grams for a term baby. Anyway, even for preterm baby, it's 20 grams a month, a day. So, which is like, that's 600 grams a month. So, 0.6 kilos. So, in it, at least baby should have added not less than 6 or 7 kilos. So your baby should be weighing not less than 9 kg. So this baby weighing 6 kg in 1 year. No. This child needs to go to the hospital. You need to go to, I don't know where you are. If you tell me where you are, I'll tell you where you can go, but you have to go to an hospital that has a pediatrician. This is not an health center issue. They won't know what to do. In fact, sometimes some general hospital self, they may not know what to do, because if I'm the one treating your child, I'm going to admit your child to the hospital. So when you are going to the hospital, be prepared to stay, because we're going to admit that child to the hospital. We're going to investigate why this child has not gained weight. We're going to treat and we're going to rehabilitate the child. We're getting the dietitians, we're getting everybody involved. We are feeding that baby, and that baby has to gain weight before you step out of the hospital. That is what I will be doing if I'm the pediatrician managing your baby. That is what I'm going to do. So I really need you to go to the hospital, and I meant that seriously. So please go to the hospital. I'll recommend going to either a children's hospital or a teaching hospital, wherever you are. I want you to be in an hospital where a pediatrician is there. A pediatrician has to see this baby. It's not just something a general doctor would do. They have to see the baby. They have to admit this child. They have to investigate the child. They have to start what we call nutritional rehabilitation. We need to check the electrolyte. We need to check so many things. So, because this is what we call acute severe malnutrition or marasmus, like people will say, your baby doesn't have any of the hands or legs swollen. So please do the needful, and you can update me. You send us a message on our Facebook group. I would like to know what happened to the baby. I would like to follow up on this baby in particular. So let me know. I worry so much about that. Okay. Yeah, Miss Fumi, thank you. You're welcome. All right, let's go on to Elanda Davis. Good evening. I was recently going through my daughter's 3-year-old vaccination card, okay? And realized she wasn't given the birth dose of hepatitis B. It's too late. You can't get that one anymore. But I'm sure we've given the baby hepatitis B in Penta. So, yes, so that's fine. Also miss your birth dose. If you don't get it at birth, it's 2 weeks grace. After 2 week grace, it is gone forever. You can't get it. But we're going to give the baby at 6 weeks, at 10 weeks, and at 14 weeks. So that's all the baby needs. It's all like she needs for now. We can give her a booster dose at 18 months. Sometimes we also give her 5 years, but it's not compulsory, but we give it to certain people, but at least the 3 doses from Penta is enough for now. Is to keep the child protected. All right. Okay. Actually, Precious, good evening. How often should children be given multivitamins? Never. Children don't need to be given any multivitamins at all. I know that's surprising, right? But you don't actually need to give children multivitamins. We want to give children food. give them food. All their vitamins should be from their food, from the fruits and from the vegetables. It's better for children to actually eat their vitamins rather than to take it as a tablet. Because when you give children all these tablets, all this syrup, there are so many other things you are giving your children that you don't know. There are many other things because the pharmacists have to put that vitamin in a suspension of something so that it will stay in the bottle for many months, and there are many other things you're giving your children that you don't know. So, but you won't know that. You only think I'm only giving multivitamin, but there are many other things inside that bottle. Trust me. So, the best way to give your children vitamins is food. So, let them eat the green vegetables. They'll get carrots, orange and green will give you a lot of vitamin A. You can get vitamin A from your oil, palm oil. That is why we actually add vitamin A to all the sugar, the butter, the flour. Once you see an eye sign on any of those things, that means it has vitamin A already added to it. Vitamin C from all your citrus, oranges, and all that. Vitamin B again from your fruit, from all the vegetables. You get vitamin B as well. Vitamin D, you get it from sunlight. Nigerians, you are lucky. And then vitamin K, you don't get that from food. We give you that injection at birth. So, but the best way to get all your vitamins is from food and not from tablets or syrup. Unfortunately, we know some mothers say, "Oh, my child will not eat. They won't eat fruit. They won't eat vegetables. They won't eat blah blah blah." Okay, so we often have to just agree with it that if the child is not eating the fruits and the vegetables, yes, it's better to give the vitamin as a tablet or as a syrup so that the child does not become vitamin deficient. So that's why we allow you to give multivitamins. But seriously, you don't need to give any of those if your children are eating well, because almost all the food they eat, and you give them variety, not just junk and sugary stuff. If you give them fruits, vegetables, they're going to get all the vitamins from that. And they need to take 5 a day. So I'm sure most of you, for those of you who are familiar with the NHS 5 a day. So there's a 5 portion of fruits and veggies that children have to eat a day to meet their daily supply of vitamins. So if you follow that, if you just Google 5 a day, I'm sure you will get all the gist of that. But basically, if your children take 5 portions of fruits and vegetables every day, so what we normally recommend is that all the snacks in between food, we should make sure there is vegetables and fruits. When children are eating, make sure that the portion, there's a portion for vegetables in the food. Everything should not just be carbohydrates and milk and all that, and alone. We should always make sure there is always that portion for fruits and vegetables and all that. But if your children don't eat well and they don't take fruits and vegetables, yes, please give them the daily vitamin supplements. It's better than none. Half a bread is better than none. So it's better to take vitamin supplements rather than be vitamin deficient. So that's, and they don't need so much of vitamins really, just a little, but we just need to eat it. Then you say, how often should warm expella be given to children? So when it comes to warm expella, because this is a program that is watched worldwide, so it varies according to where you live. So we recommend, if you live in places where there's a lot of worms and high worm prevalence, like Nigeria, the World Health Organization recommend that you start deworming your child from age of 1 year, and you do it every 6 months. So you start deworming from age of 1 year, because I see a lot of you asking questions to deworm your 6 months old, your 5 months old. Please, you can't deworm the child on breast milk. I mean, where is the worm coming from? Unless from the mother. But so you don't deworm before age of 1 year, and then after that you do it every 6 months, and that will be fine. And now that is what we call prophylactic deworming. Now you're deworming a child who does not appear to have worms. You are just trying to prevent the child from having worms. Now, that is different from a child who already has worms. If a child already has worms infestation, is passing out worms, we need to treat that child. That one is different from just the routine prevention deworming. When your child already has worms, we treat them. And the way we treat them is to give them worm expella maybe for 3 days, depending on the kind of worms worried about, and we repeat it in 2 weeks. But for a child who doesn't have worms, who is not passing out worms, we give them every 6 months. Why? Before I leave your question, I just remember that vitamin A, we give your children vitamin A supplements as well, because vitamin A is one of those vitamins that is so crucial. We don't want children going blind because of vitamin A deficiency, and it's the number one cause of preventable blindness. In other words, people can become blind just because they didn't hit vitamin A. So to avoid trouble, avoid children going blind, getting malnourished because of vitamin A, we give all our children in Nigeria vitamin A every 6 months, oral vitamin A, because luckily it's a vitamin that stores in the body. So when we give it for when we give you one capsule, the oil, it will last in the body for 6 months. So before the child will be due for the next one. So vitamin A, we give it as a drop as well, because we just don't want to take chances. We don't want any child going blind for something that just a drop of oil would have taken care of. But all the other vitamins, we expect you to just eat them, and that will be fine. All right. Let me see whether I have any question on Instagram. No question on Instagram. I think that's all. Oh, sorry, I have more questions. Okay, I didn't say before. All right. Favor Ikechuku say, my son has cough and catarrh. What medicine should I give him? How old is your son? Always start every question with the age of the child. It's amazing how often I have to say that. I say it every day. So tell us the age of your child, Favor, number one. Number two, I don't recommend you give your child any drugs per se. And then if your child is less than 1 year, please don't give him cough syrup. And if the child is breathing fast, you need to go to the hospital. You need to go to the hospital. So if a child has cough and catarrh, but they're otherwise well, they're eating well, they're drinking well, sucking well, depending on the age of the child, most of those ones will go by itself, because most of them are due to viruses. You don't need to give them any drugs. But if your child is having cough and catarrh and there's fever and they are breathing fast, you have to go to the hospital, because that child may likely have what we call pneumonia. Pneumonia is one of our killer diseases, one of the diseases that kill our children. It's one of the top 5. Pneumonia, diarrhea, malaria, they are the killers of children. It's amazing. These are very simple, well, in quotes and unquote, simple condition, because we can treat them, we can prevent them, we have vaccines against them, but they are the one killing our children, coupled with malnutrition, which we've talked about already. So we don't want to take chances with pneumonia. So once a child starts breathing fast, it means something is going wrong. You need to go to the hospital. We need to check. We may need to give antibiotics. But a child will have cough, catarrh, nothing else. We just watch and wait for it to clear by itself. And, keep breastfeeding, keep doing the usual stuff. So that's all we expect you to do. Okay, your baby is 10 months old. Okay, so 10 months old, yeah, you keep breastfeeding, but you need to take the child to the hospital because of the breathing. If the nose is blocked with mucus, you can put saline drops. Saline drop is normal saline, the normal sorts that you use in your kitchen, mixing water, but you can't prepare it yourself because it has to be sterile. So if you go to your pharmacy, saline drops, don't go and take another nose drop. It is saline, normal saline. And a lot of mothers will post pictures of other things and will asking me, oh, is this saline nose drops? And I'm like, this is why we want mothers to be educated. It is one of the child survival strategies. Education, female education is very important in children's survival. So that's why you go to school to read, so that you can read, because you need to know that this is not normal saline. So all mothers can read. If you're on Facebook, you are able to listen to me, you can read, then you should be able to read. If you don't see them write normal saline on that or saline on that nose drops, it is not normal saline. Don't believe whatever anybody else tells you. Remember that most of our pharmacy, they are just trying to sell the drugs, and sometimes I see people, they sell what they call it, they sell steroids to mothers, and they will tell them, don't give your children steroids into their nose when they have just ordinary cough and catarrh. you're going to make things worse. So make sure it is saline. And the saline is not a treatment for cough and catarrh, just to be clear. The saline is just to soften that thick mucus. It will make it flow so that it will come out. Then the child can breathe through the nose better. So the fact that you put saline does not mean the cough is going to go or the catarrh is going to go. Is not a treatment for the cough and the catarrh itself. Those ones will take their time, usually 2 weeks, and they will go. But the saline will soften the thick mucus. So most time children struggle. If you are an adult, you can cough, you can sneeze out your whatever is blocking your nose, but children may not be able to do that. But if you put saline, 1 drop in each of the nostrils, maybe 3 times, morning, afternoon, and night, it will soften the mucus and then to flow. If the mucus is already flowing, you don't need saline, because I see people, their children, they have running nose, the nose is flowing, but they still go and buy saline. Saline is not going to treat the catarrh, it's not going to treat the cough. It is just to soften mucus. So if the mucus is already flowing out, you don't need to buy saline drops. But if the mucus is so thick and it's not flowing out and the child is struggling to breathe through the nose, then you need to buy saline drops. The breathing of the chest, a child who is breathing fast is different from a child who is breathing through the mouth. They are two different things though. So if you are not sure, you better post a video of that child breathing, then we can tell you. Because when a child is having difficulty with breathing, it is from their chest, not the nose or the mouth. It's from their chest. You see that the chest is going in and out very fast, or you can see holes like spaces in between the ribs. It's so obvious. You will just know that this child's breathing is noisy. Breathing should be noiseless, should be, or you shouldn't even notice that somebody is breathing. I'm breathing as I'm talking to you now, but you will not notice I'm breathing. So, but if you start noticing that your child is breathing, that means they are breathing fast or they are breathing hard. Those are the instances where you need to go to the hospital. So, favor, I would suggest that you go to the hospital, because this child is breathing fast and it is not. We just need to be sure there's nothing else going on with the child. All right. Somebody's asking, is nasal spray the same as nasal drops? I don't think so. I'm not sure I've seen saline spray. I tend to see it as a drop. It's water. It's like water. You just drop it. But, there are some other nasal spray, but they are most of the time they are not saline spray. They are most of the time steroids. So don't go give your child. But if you read it, because sometimes pharmacy people they have made another one. I mean, I don't know. But if it's saline, and as long as it's saline that is written on it, whether it's spray or whether it's drop, it's okay. But it has to be saline. But so just be careful. They don't go and give you steroid in the place of saline. I hope that's helpful. All right, our time is going. Let's rush. Rachel is saying my baby of 7 weeks is 5.9. Okay, birth rate was 4.7. Well, the weight is okay. The weight is actually big. Your baby is big from the beginning. You should see a pediatrician as well about that. Why is baby on mixed feeding? Baby should be on breast milk. And it doesn't poo every day. Baby doesn't have to poo every day, but this one you are doing mixed feeding. We hope it's not constipation from the formula, but I would recommend your baby should go on breast milk only. Only breast milk. As long as you are lactating, just give breast milk only. There's no reason for you to be giving. Okay, so if the poo is looking like that of an adult, then that means your baby is constipated, and that is the effect of the formula. Okay, babies on breast milk don't have those hard poo. Their poo is actually like egusi, like soft solid with mixed with a little bit of water. That is what you get with normal breast milk kind of stool. But if you're having this bulky stool that of an adult, it's because of the formula. So I think you should just stop it. I don't think there's anything, because if you are doing mixed feeding, it means you are able to breastfeed. So just breastfeed only and leave the formula out of it. But secondly, I think you should see a pediatrician about your baby. Your baby 4.7 is quite big. So unless you have diabetes yourself, or you know why your baby is big, it's important to make sure there's no other medical explanation for why your baby is so big. Because there are some medical conditions that can make babies to be very big. So we need to be sure it's not one of those. So that is just on the side anyway. But I recommend strongly that you just breastfeed your baby only, really. That will take care of all the stool wahala, take care of the constipation, take care of everything. And it will also help you regularize the weight of the baby so the baby doesn't keep adding too much weight. Because in as much as we want our baby to add weight, I know I've talked about a baby who was very small, 6 kilos at 1 year, and I'm really freaking out about that baby. But at the same time, we also don't want the baby to be too big, because too big weight puts pressure on the heart of the baby. It's also not the good. So we don't want the extreme. We don't want too small. We don't want too big. We want baby to just be normal weight, normal in the middle. So that's what we want. Yeah, yes. Ishama, send me a message. Oh, you didn't get everything I said. Oh, sorry. So, but basically, yeah, Ishama, the only thing I really want you to do is to take that baby to the hospital. If you get that one, that's all. Take that baby to hospital, preferably go to a teaching hospital or a children hospital. I want a hospital that has a pediatrician. And like I said, I don't know whether you are able to hear this part. Your baby needs to be admitted. That baby must be admitted. So if you go to any hospital and they are telling you just go home, go and be giving food, they are not telling you the right thing. And I'm saying that because I know sometimes you may see somebody and they may say they are pediatricians and they are not. Because in Nigeria anything can happen, so I know what happens everywhere. So please, if that's why I want you to go to a government hospital, a teaching hospital, for example, because I know they will admit your baby. If you go to a teaching hospital, they will admit your baby because your baby has crossed what we call the threshold. Your baby has crossed into what we call the severe level. We need to admit that baby. We need to rehabilitate that baby, and we have to work fast. So you must go to, if you catch that part of my explanation, that's the important information that you need at this time. That baby needs to be in a house. That baby should be on admission. That baby should be on a bed in an hospital and be monitored by a pediatrician. That is the most important thing. So just send me a message if you get that part. At least I want to be sure you got that one. It's very important. Good evening. Well done, ma'am. My 5-year-old eye is looking red, bringing water. Yeah, the baby has eye infection, conjunctivitis. What should you do? You need to go to the hospital as well. So your baby must have some what we call conjunctivitis. I think one of our Dr. Peju Samoyeri, they took this particular topic. Also, I think maybe earlier in the year, maybe the first or the second episode, we did it on Thursday. So you may want to listen to that. She talked about this, but this one, you need to go to the hospital. You need to, you can get like a small clean clothes with put in water, clean the face, but you still need to go to the hospital because they need to prescribe the particular eye drop that you need to apply to the baby's eyes. And please, when you are applying the eye drop, don't let the plastic of the eye drop, don't let it touch the eyes. A lot of parents do that because in the process, if you allow it to touch the eye itself, you have introduced that germ into that the antibiotic container. You have introduced the germ, and that is why it doesn't seem as if the infection is not going. So you have to make sure that when you're applying it, you drop it into the eyes, but the tip itself must not touch the eye. So, but you need to get to the doctor so that they can prescribe the appropriate antibiotic eye drop. Please, you have to go to the hospital because it is not every eye drop you can use for every child. And there are some we give to children, there are some we don't give to children, depending on what we are thinking. So that's why we can't just say you go and buy this particular one because there are other information we need to know. All right, Rachel, Elijah, it doesn't suck directly from the breast. Okay, that's the baby that you are done breastfeeding, except via bottle. You see, that's the problem. Your baby is just 7 weeks. You are the one creating this issue for the baby. You have already created what we call nipple confusion. So this baby is confused between the bottle and the nipple. We don't want you to introduce bottles to babies at this age at all, because this is what will happen. They are going to go for one of them, they won't go for the two. And now your baby will favor the bottle and they're not going to suck on the breast. And when your baby does not suck on your breast, the breast milk production is demand and supply. So if baby doesn't suck on the breast will not flow. And then you're going to go, it's going to be a vicious cycle. Then in another 1 or 2 weeks, now you will tell us, my breast is not flowing again, then it's going to be permanently formula. Formula is not the problem. Formula will give your baby food, but your baby needs more than food. Your baby needs protection against infection. You are not going to get that from no matter all this formula you people buy. You say, oh, it's the best formula in the world, it's the most expensive. None of them is close to breast milk. None of them is close at all, because none of them is going to give your baby that protection against germs. The only thing they are going to give your baby is food and its weight gain. But all the protection your baby needs against all the germs that you have fought as a mother, all the infection you've had as a mother, you have the antibodies against those germs. You pass it on to your baby through your breast milk, and it's only you that will pass it to your baby. Every mother's breast milk is unique to your baby. It's unique for you to your baby. So you're not going to get that from formula, and that is the problem with formula. And that's why we want your baby to be on breast milk, so that your baby is protected until they're able to, produce their own antibodies and all that. That's why we preach all this exclusive breastfeeding. It's not because we want to punish anybody, but we know that the benefits of breast milk, you can never get it from formula. So it's best for your baby to be on breast milk. So the way forward is for you to still put your baby to the breast and stop that bottle. Even if you don't want to use, if your baby doesn't want to suck directly, it's better to give your baby a cup and a spoon, because then the baby will not be confused between your own nipple and that of the bottle. That is what has happened. We call it nipple confusion. If you want to Google, you can read more about it, or you go on our website, on our group, you read more about nipple confusion. So it's still early. That's why for a 7-week-old, a 7-week-old should not be on bottle. Baby should be on breast milk only. Even if you have to give express breast milk, give it with a cup and a spoon. If you go to our hospital, you will see the nurses giving babies with cup breast milk. They don't use bottle in the hospitals, at least if you go to a proper standard teaching hospital. So that is the issue. So formula once a day, there's no need. The formula is not doing much, so just give your baby breast milk. Take away the bottle, just give breast milk. Don't worry, 1 or 2 days the baby will get back to normal. And you may need to go watch our breastfeeding videos. So some of breastfeeding is not, it's not just a natural thing for people. People just think you just breastfeed. No, we have to teach people how to breastfeed sometimes. And so there's a way to breastfeed, there's a technique, there's a science, there's an art to breastfeeding. That is the job of us pediatricians and the nurses and the midwives. We're supposed to support you as a mother to breastfeed your baby. This, I think we should make sure you have master before we discharge your baby from the hospital. So it's our fault, I accept that. So, but we can still teach you how to do it. So if you go to our own Facebook group, we have the guide session, we have the breastfeeding guide 1. There's a video on how do you position your baby, how do you attach the baby to the breast, because the reason why sometimes babies don't suck is because they are sucking on the nipple and not the areola. When they suck on the nipple, the milk does not flow, baby is frustrated, mother is frustrated, everybody is not happy. So we want to make sure that you put much of the nipple and that areola, that black part of your breast, it has to be in the mouth of the baby. If you go to our past videos on breastfeeding week, we always do this. I think one of our nurses have come and demonstrated it before, so you can watch all those, or you can just watch those breastfeeding videos. Make sure you get that positioning and latching of your baby to the breast correctly, because latching, attachment of the baby to the breast is 98% of the breastfeeding. If you don't get that, you cannot get breastfeeding right. Breastfeeding should not be painful, should not be stressful, but you need to get it right from the beginning. The positioning is very key, and you need to get the baby off the bottle completely and let the baby just suck on that breast. It's the sucking on the baby on that breast that will make the breast milk to flow. And once the baby master it, baby will be fine. So both of you have to learn. Your baby needs to learn how to breastfeed. You also have to learn how to breastfeed as well. But we have a lot of videos that can help you through that, and then you can just get rid of that formula completely. Don't worry. If you need help, see your pediatrician or see one of our midwives. The nurses can also help you. They can teach you how to do it properly. So that's the best thing to do. We have baby-friendly hospitals. They are very good. We have lactation consultants, and they are very good as well. But just watch our videos first, and that may just be all that you need. So I want to encourage you. Don't worry. That's one of my own jobs, to encourage you to get to breastfeeding your baby. Okay, my time is up. I need to go. Let me just answer one more question on Instagram, then one more question on Facebook, and then I'll go. Ricky on Instagram. My baby is 3 months. I have to start combine feeding because people are not getting enough breast milk. It's always sucking. Okay, it's like you people want to convert the rest of today's presentation to breastfeeding class. Okay, now Ricky, what is the weight of your baby? What is the birth weight? What is the current weight? So I don't have time, but let me just let you know that your baby sucking and always sucking is does not mean the baby is not getting enough breast milk. That is not how to know baby is not getting enough breast milk. For those who are familiar with this program, and I've said it 100 times, the baby will suck not only because they are hungry. Baby sucks for many reasons. Babies suck because they want to be close to their mother. They suck because they just want some, comfort. They turn your breast milk to their like comforter. Babies suck for many reasons. Baby want to sleep. They just want to suck to sleep. That's why some people you put the breast in their mouth. They are sleeping. They are still sucking. You want to remove the breast. They will start grabbing it again. They just don't want to let go. So that is not how we know baby's not getting enough breast milk. The most objective way to know your baby is getting breast milk enough is the weight of the baby. It is not how many hours the baby stay on the breast. It is not whether the baby is crying. It is not any of those things. It is the weight of the baby. A baby who is gaining enough breast milk will gain weight. End of story. That's all we need to know. If your baby is not gaining weight, then we know your baby is not getting enough milk. If your baby is taking enough milk, baby will gain weight. So you weigh the baby. Baby's weight is fine. Whether the baby cry from morning to night, baby is getting enough breast milk. So you need to know that there are other reasons for sucking. Sucking is not just about hunger. That is the most basic things, but mothers always miss it up because everybody think when baby cries, it means they are hungry. No, baby cry, that is the only language they speak. Even when they are happy, they can cry. I'm telling you the truth. But maybe we'll come back to you. But if you want to really know, so there's no reason for you to put your baby on combined feeds. Just go back to your baby sucking breast only. Go and check the weight of the baby first and come back. That is the most important thing. Or you ask your pediatrician about that. There's somebody say, when does baby start responding to their name? Usually around 7 months. Baby starts to respond to their name by 7 to 8 months. They can hear from birth. They can hear all from newborn. So, but knowing that this is my name, and when you call them and they turn to their name, usually from around 7 months thereabouts. Okay, so I got to go because I've gone 7 minutes past the hour. But thank you so much. I really appreciate all of you joining me today. If you have any questions, feel free to go to our Facebook group, Ask the Pediatricians. We are always there 24/6, because we're not there on Sundays. So I can't say 24/7, but 24 hours, Mondays to Saturdays, we'll be there. Ask your question. All those people asking questions about breastfeeding and weight. Sorry, I don't have enough time to go into the details because we can just be here the whole day talking about breastfeeding. But feel free to go to our Facebook group, ask those questions, because I want you to ask those questions, because somebody in our group will link you up with our guide one on breastfeeding, so you can watch all the videos and you can do. I'm sure you will see all the testimony on our group. We encourage people to breastfeed well, and they do, and they always are very grateful for it. So we are happy to support you on that journey as well. On Thursday, we'll do another teaching. I think we're supposed to take a teaching on cancers, and children can have cancers too, and how to recognize, how to prevent it. It's been Cancer Week on the 4th of February, so we need to talk about it. So watch out for that. I think one of my friend oncologists will be taking that presentation. So, but I'll be back again next week, by God's grace, answering any question you still have about the health of your children. So then, have a wonderful evening, and it is bye-bye from me. Bye. Apologies for going over the hour.